The Ray Dolby Brain Health Center exists to improve the quality of life of both patients and their families and loved ones that are dealing with degenerative diseases of the brain that can affect cognition. So we primarily see patients with Alzheimer's disease, as well as other dementing illnesses like Lewy body disease or frontotemporal dementia. And the clinic exists because we recognize that not only does a neurodegenerative disease or a dementing disease affect the patient's brain, but it has wide-ranging effects on the family. And so our entire clinic exists to treat the patient, but also the family, so that they can have a better quality of life.
It's often hard to tell in the beginning if the things that I'm feeling are something progressive or if it's part of the aging process. How we get a sense of whether that's due to something progressive or concerning like Alzheimer's disease is really through detailed cognitive testing. It can be hard just on an initial visit to really know for sure what's going on. And so it's really the detailed cognitive testing that we provide where we compare people to others of their same age and education level to get a sense of, no, look, everything that you're experiencing is totally within the bounds of other people like you, or no, this is something that is maybe going beyond, and let's dig into that a bit more and see if we can figure out what's going on.
In the age of biomarkers for Alzheimer's disease, one might also ask, why do I need a diagnostic neuropsychological exam? We can now test if someone has Alzheimer's disease. And one thing that neuropsychology does is it helps understand a person's functioning as well as any cognitive decline. So even if we know someone has Alzheimer's disease, that doesn't mean we know if they've had a cognitive decline yet.
Every patient that comes to the Ray Dolby Brain Health Center is assigned a social worker and a therapist. Most of the time they come in thinking, oh, I don't need it, or, what is this for? And then they eventually find it indispensable, and they find that that's what makes the difference between this clinic and many others, is the dedicated time that we can spend with them to help them navigate this disease.
The social worker is a very important part of the care. Howard has been my go-to person for the last 10 years. Whenever I have a question, I call Howard. Email him, he gets right back to me. If it's something he doesn't, feel he can handle or needs more, he'll say, I'll talk to Dr. Magamian and get back to you. So he's been our lifeline.
Well, Gretchen first started being concerned about losing bits of language. And so I felt that she was overly concerned from that standpoint. And, and then we found the Ray Dolby Brain Center, and we said, well, let's get a baseline, find out where you are.
My role here at the Ray Dolby Brain Health Center is I am a family support coordinator. And what that means is that the Ray Dolby Brain Health Center is the only health institution in the United States actually that has an employee from the Alzheimer's Association embedded into their program. So it was pretty unique and pioneering. And then what we provide here is education classes, support groups, early stage engagement programs, one-on-one care consultations. The Alzheimer's Association has a 1-800 helpline that people can call 24/7. So it's just an added layer of support and connection and services for patients and family members at the Ray Dolby Brain Health Center.
Last year, in about November at our visit here, Dr. Magamian told me that I should start looking at places that Marty could maybe eventually go into a memory care because things were changing.
They come in and we know their whole story, and that they're not just a number. We know what they've been going through. We know the ups and the downs. And so we're really with them, standing beside them on the entire journey.
I started having problems with my brain when I was a very busy and successful realtor. That's how I kind of found my way to this place. And Dr. Magamian did a 2-hour, initial consultation, And at the end of that, he said, I think you have early onset Alzheimer's, which was totally not something I expected.
Some of the things that have been happening in the field, specifically in Alzheimer's disease, that are really exciting are these new therapies that, for the first time in the history of the disease, are showing that they can actually slow down the trajectory of the disease. They can slow down the disease process. We've never had that before.
I think recently, John just started the new drug for Alzheimer's, and Dr. Magamian's got it all set up.
So it's called lecanemab. That's the brand name. It's Leqembi is the other name, the regular name. I'm hoping that it will help, slow things down.
We also engage in research, so we're here not just for diagnosis and evaluation, but we want to advance treatments. And so all of our research at the Dolby Brain Health Center is to be able to offer patients and families the earliest access possible to novel therapeutics.